The human body is amazing.
So how do we decide between a good, better or best work when it comes to a lid surgery? कुछ ऐसे procedures हैं जो उस scar को और कम कर सकते हैं?
Really, as a surgeon, it makes me crazy. In fact, the problem that starts is dark circle, which makes them look tired. Even if they're fresh, they still feel that they are tired and they look tired. People not only just want to remove eyelid skin, they want to have a certain look like foxy eye.
Like Catwoman.
Not so much of Catwoman, but
Hi everyone, welcome back to this podcast. Today, let's talk about one problem that a lot of us start facing after the age of 50. I've had this lady who's come to me, her daughter's about to get married in 2 months, and one of the biggest issues that she has is even if she tries to put an eyeliner, her eyelids are drooping so much, उसमें इतना ज़्यादा sagging है कि वो eyeliner ही नहीं लगता है. So today we've got Dr. Sanjay Parashar, and let's talk about how we can help this lady make it to her wedding with a good eyeliner outcome.
so this is the common problem now with women, they face when they're putting their eyeliners or when they're putting shades.
Right.
A time comes when there is smudging of the makeup, and that happens because when the lid folds onto itself. जब स्किन को टच करने लगता है तो फिर मेकअप स्मज होने लगता है.
Does that happen for even kajal pencils?
Absolutely. So what happens is that is because of either droopy brows or excess skin that they form in the upper eyelid, particularly where it forms and covers the crease, and sometimes so much that it covers the eyelashes as well. And some of the people are not able to see clearly, particularly in the vision. So they get obstructed vision. They are not able to look up. They have to literally turn their head to look up. So
you're saying this part of the eye has
Correct.
come down to such an extent that it's touching this part of my
eyelash.
And some people start having something which is literally hanging like an overcoat,
Correct.
stopping their vision
Correct.
completely.
Correct.
Right.
So we can remove that. We can correct that. And that is the process called as eyelid lift, or
Right.
technically called as blepharoplasty.
Right. It's also called, I believe, eyelid surgery, but is it different from double eyelid surgery?
So double eyelid is a different thing. Double eyelid means normally we have two eyelids.
Right.
Okay. One is the eyelid, which is the lid part of the lid which is just above the eyelash, and then second is the fold that covers the
Right.
crease. That's two eyelid. But in some people there's only one eyelid where the crease is absent and the skin actually folds onto the eyelash, and often happens in Orientals, particularly from eastern part of India.
Right.
So when we correct that, it is called as double eyelid surgery, because we are creating a double eyelid, so called double eyelid.
Oh.
Okay, so that's slightly different than an eyelid lift or a blepharoplasty, which is done to remove that extra skin. These are two different problems with two different,
I think a lot of people out there actually believe double eyelid surgery is this one and this one together is double eyelid surgery.
So that is called double lid surgery.
Double lid surgery.
Or it's called four lid surgery. So when you are doing only the upper eyelid, it may be called as single lid surgery, which is only the upper eyelid, right? Or if you're doing four lid surgery, means doing on the left, right, upper and lower eyelid.
Okay.
But the double eyelid actually is for Orientals with a different set of problem, where we create a crease to open up their eyes. That's double eyelid. Whereas blepharoplasty is we remove the excess skin so that they are able to apply the liner or the shades better.
But that would also help open up the eye as well, right?
So it does make it open. It does remove that lazy look sometimes, or a droopy look on the eyelid that they may have.
So no matter which kind of lid surgery you do, you'll always look
like a wow.
Absolutely fresh.
right. So what kind of patients, I mean, apart from this lady who obviously wants to get it done because she's not able to apply makeup, but what are the other kind of patients that we get who need an eyelid surgery, who need to undergo blepharoplasty, apart from just upper eyelid sagging?
See, it's very interesting, and let me answer you in a different way now. People are now very educated and they have all the information in the media. So I get young people coming saying that I need eyelid lift surgery, as young as maybe in the late 20s. and that is not the correct age to do an eyelid surgery or a blepharoplasty. Ideally, blepharoplasty is done for people who are above 40 years of age,
Right.
or if they are younger and they have excess premature aging eyelids. The reason is, in younger people, if you do an eyelid, the scar will be visible
Because it's not hidden in the
because
crease?
it's not hidden in the crease. Whereas in older people, where they have more wrinkly skin, when you remove that excess skin, the scar falls nicely in the crease and it's invisible.
So not all wrinkles are bad.
Not all wrinkles are bad. This is a favorable wrinkle.
It's a favorable wrinkle. But I mean, overall, there are a lot of people who might want to go ahead with sort of improving their eyelid looks. But there are some people who don't want to go ahead with the surgical option. There are some people who want to go ahead with the surgical option. So, किन के लिए surgical option better है? किन के लिए surgical option is not good. So, one, definitely आपने जो बोला, age, above the age of 40 जिनको sagging है. But apart from that, who else qualifies
So
for
mostly
this?
it's age and it's the severity of the problem.
Right.
So we grade it, this is like grade 1 for example is just a little skin above the crease. I wouldn't do surgery for them. I would not
Right.
recommend surgery for them. I would recommend them to do something else like a Botox or whatever, to improve, but not surgery.
But what about the ones who start developing eye bags? They have
Eye bags is
visible.
in the lower eyelid.
Yeah.
Okay, so lower eyelid has different problems than the upper eyelid. Lower eyelid, the biggest, in fact, the problem that starts is dark circle. That's the
That's
youngest
true.
people's problem, But of course, surgery is not done for that. Surgery is done when they develop eye bags, which makes them look tired. Even if they're fresh, they
Yes.
still feel that they are tired and they look tired.
Right.
Or people who have very wrinkly skin. And that's again older people, let's say above 45, 50 or even 55, 60 years old where they have a lot of wrinkly skin. So the lower blepharoplasty, which is the lower eyelid lift, is done for those people.
I have had, Dr. Sanjay, patients come who are actually as young as early 30s or mid 30s that have very wrinkly skin, either because genetically their family, genes have given them the jackpot of aging faster, or they've had multiple episodes of weight loss, weight gain and थोड़ी बहुत insulin resistance start हो गई है. तो acanthosis जो एक skin condition है, वहाँ पर स्किन का टेक्सचर चेंज हो गया है, स्किन का सपोर्ट चला गया है. सो नाउ अगर हम स्किन पिंच करते हैं, विच इज़ जनरली कॉल्ड द स्किन पिंच टेस्ट, द मिनट यू पिंच दैट स्किन, इट टेक्स फॉर एवर टू गो बैक इन. Are those also patients जिनके लिए you would think about doing lower lid surgeries?
So the primary cause of that is if they are not old enough, is dehydration.
Right.
Dehydrated skin, where they have not taken care of their skin for the lifetime. Not using sunblock, not using moisturizing cream, and or over enthusiastic washing and cleaning and toning and and alcohol material to clean or wipe the makeup. That makes the skin dehydrated, and that causes wrinkling. So my first treatment would be to correct that problem first. So in younger people, I would recommend them to do more of a skin care program to improve the quality of the skin rather than blepharoplasty. So no, they are not the I wouldn't do them blepharoplasty for them. Blepharoplasty is more for people who have aged enough, where no matter how much hydration you do on the skin, the wrinkles don't go away. So in them we recommend blepharoplasty.
Right, definitely. I've had a lot of people who've come to me and the biggest concern is कि मेरी आंखों के आसपास कालापन हो गया है या skin loose दिख रही है या I look tired all the time. And a lot of this happens to be for people who are leading hectic lifestyles or they're in front of the screens a lot. That is one of the major reasons why they start having that tired look around their eyes. And over a period of time, they develop other things as well, which, is sagging skin, pigmentation, all of it. So, अगर कोई lid surgery कर रहा है, वो सिर्फ ऊपर वाला हो या ऊपर या नीचे वाला हो, what can they expect at the end of the surgery? What is the kind of recovery time they are looking at, and इस surgery से उनको क्या-क्या benefit मिलेगा?
So usually these surgeries are short surgeries. Takes about an hour, hour and a half, not long.
Right.
And most of the time it is done under what you call local anesthesia or little sedation where they are sleeping with the medication.
So short and sweet.
Short and sweet. And then the stitches are there which needs to be removed
Okay.
after a week.
Okay.
So obviously physically they are fine to move around, but socially they will not be. So either they have to wear big celebrity style goggles to hide themselves, or stay away from, you know, critical people who tend to criticize and question.
Right.
But yeah, typically it takes about, let's say, 10 days to 2 weeks for them to look normal to face people.
So for 10 days to 12 weeks, their favorite song will have to be Kala Chashma.
Absolutely. Yeah.
All right, and post those 12 days, the sutures have come off.
Come out. Swelling is
gone.
less.
Okay.
It's not completely gone, but at least it's presentable where they can comfortably go out and do the things.
Yeah.
And like any other wound in the body or any other surgeries, 4 weeks they're back to exercise, doing everything. But obviously they have to, sometimes they may have to use some makeup to cover if there are any bruises or things, you know.
Right.
And take care of the skin afterwards by moisturizing cream and sunblock and so on and so forth.
Right. Is there any patient जिसमें आप eyelid surgery नहीं करोगे?
So, like I said, you know.
No, I mean, let's take away the age and stuff.
Okay. Health important.
Health
Condition बहुत
there
ज़रूरी है.
are some people who confuse कि मेरा ये वाला lid है कि, you know, is it something that's going to improve?
So it's very important, you know, when somebody feels कि ऐसा आपको लग रहा है कि I'm looking tired or whatever problem I have around the eyes, best is to meet the expert.
Right.
And try to understand what exactly is the problem. So an expert like me and you, we can identify and see कि problem कहाँ है, problem brow में है, eyelid में है, skin में है, उसके लिए क्या moisturizing cream लगेगा, या ये botox लगेगा, या कि surgery लगेगा.
Very true. Very true.
And then that specialist will evaluate your health and tell you whether to go or not to go for any treatment or surgery.
100%. I mean, someone in their late 20s, early 30s, सिर्फ primary wrinkling है, and you know they have very strong frown complex. A little bit of Botox itself gives that sort of lifted look that they want, the relaxed look that they want. Agar skin requires a little bit of love and care, you do a little bit of PRP, you'll do a few peels or a good skincare routine, that makes a difference. For all of the people who end up spending a lot of time in front of screens, vitamin K as a serum is such a beautiful option. And nowadays you've got combination with caffeine and peptides as well in serums, and overall that makes a huge impact. Do you ever do lid surgeries for somebody, especially the lower lid surgeries, for somebody who's previously, let's say, had a procedure like fillers or Botox and stuff? Is that...
So, yeah. So, nowadays, you know, a lot of people undergo fillers.
Yeah.
So, there's no problem. You can still do blepharoplasty, but sometimes you have to dissolve the filler first. And that's actually the right thing to do to begin with. At least the major part of the filler. Then we are able to assess better and to see how much removal of the skin or how much tightening the person needs.
So how do we decide between a good, better or best work when it comes to a lid surgery? Is it in how visible the scars are, how, you know, how wide the eyes are, or how fresh they look post the surgery?
I think it's how fresh they look and how natural it looks.
Right.
Okay? But interestingly, more times have changed. People not only just want to remove eyelid skin, they want to have a certain look like foxy eye or cat's eye. So there's a lot of these new trends happening now, and that makes us crazy. Really, as a surgeon, it makes me crazy. But sometimes, you know, I've seen some people it looks good, and I've done few in some of them where I have done actually a foxy eye lift. From going from the hairline, and the way then they make up and then they present themselves, they look beautiful. So sometimes I'm encouraged to do these procedures.
Like Catwoman.
Not so much of Catwoman. That's probably one of the other extreme. But at the same time, there are people who go crazy, and you will see all of those in the media, you know, with eyes pulled that they are not able to actually see clearly. That's something which is very extreme. But other than that, something that is done more naturally, have a good outcome, minimal scar is probably the best work, I would say.
If किसी की skin ऐसी है जो अच्छे से heal नहीं होती है, तो post the removal of the sutures, अगर थोड़ा बहुत scar line visible है, are there something that we can do apart from creams? I mean, creams obviously to an extent help, but they also have their limitations. कुछ ऐसे procedures हैं जो उस scar को और कम कर सकते हैं for someone who's
lasers
hesitant?
can be done, like flexel laser can be done, or
Yeah.
there is this technology called plasmage, which is plasma treatment that can also be done to improve the scar. So there are
This carbon dioxide laser will also help me to reduce.
Frexel laser, fractionated laser, carbon dioxide laser will help.
It definitely helps. So both for upper eyelids, lower eyelids.
Correct.
So is lower eyelid surgery a little bit more skill based than upper eyelid surgery?
Yes, absolutely. Because
Okay.
there are more elements that needs to be corrected. In upper eyelid, it's usually the excess skin,
Ji.
maybe a little fat pocket. But
Okay.
lower eyelid is a bit more than that. So
Right.
skin, fat pocket, treating the under eye circle, and yet making them look natural and normal without any problem requires a certain
Is there any way, Dr. Sanjay, to do these eyelid surgeries but without any scars?
So there is a, yes, absolutely. So there is a procedure called as transconjunctival blepharoplasty, which is done from inside.
Right.
So there are no cuts outside at all. But those are limited only to people who have good skin quality but just fat bulge. So usually done in younger people. And
Younger
I wouldn't
people.
name the celebrities, but there are some celebrities who have had this done.
Right.
And that's why they look young even when they are in their 50s.
Next time you wonder, I think this is probably the procedure that they have gotten done.
Yeah.
So, but transconjunctival means कि मतलब आँख के lid के अंदर जाकर वहाँ से आपने जो है fat bulge को निकाला है. So this is a extremely high skill level
Not
surgery,
extremely high.
right?
It's a normal surgery for a plastic surgeon who is experienced enough. you know.
Right.
It sounds, but
Yeah.
in fact, it's very easy.
Okay.
It's simpler than going from outside.
Right. And most of these procedures, like you said, are primarily in local anesthesia.
Yes.
This transconjunctival
Even
be
transconjunctival as well.
Is
With
in
some
local
amount of
anesthesia.
relaxation
Okay.
that we give in the form of IV.
Yeah.
Yeah.
A lot of plastic surgery procedures sound like I'm relaxing before, and then I have 2 to 3 months to sort of, just absorb the good results that are coming to me, and then start on a new life, a new journey altogether. So
That's
definitely incredible. What are the precautions that somebody who's planning to undergo an eyelid surgery, तो procedure से पहले उनको क्या करना चाहिए और procedure के बाद उनको क्या नहीं करना चाहिए?
So procedure के पहले सबसे important is to maintain their health. So the usual blood pressure or medications, vitamins, ये वो सब देखना पड़ता है हमें. बहुत ज़्यादा preparation नहीं रखती है इसमें.
Right.
But aftercare is there. After the surgery, they have to make sure the way they wash their eyes, the way they clean their eyes, the way they put makeup in the first 2 weeks. That's important. But once the healing is over, then it's back to normal, absolutely normal.
And there is no hesitation with कौन सा skincare product लगाना है?
No.
Any
Absolutely.
makeup
Whatever suits
item?
their skin
Okay.
is good.
All right. Generally, people who undergo multiple episodes of weight loss and weight gain end up having a little bit of hollowing that happens around the eyes. So I like the conversation that I have with them is about the fact that there is something known as periorbital fat. So I've had a few people who've come up to me who want to understand what is this periorbital fat. मतलब आँखों के आसपास का वो fat क्या है, उसका importance क्या है, and उसका lid surgery से कोई relationship है कि नहीं है. What do you have to say to that, Dr. Sanjay?
So there are, it's very interesting. The human body is amazing. What
Right.
God has created is simply amazing. So there are different pockets of fat in the eyes. There is a pocket of fat which is to cushion the eyeball.
Right.
Okay, which is all around the eyeball. And eyeball sits on that pocket of fat.
Okay.
Now, unfortunately, with time, this pocket of fat protrudes out and bulges, and that's the puffiness that you see.
There you see.
So, which you can do the treatment for. Then there are fat pockets which is around in the orbital socket area. There's something called as roof, like the roof,
Right.
and soof.
Right.
So that's the layer of fat which gives volume to the eyebrow. So people who age, they lose that fat, the eyebrow deflates and it sags. So you can actually do some filler for them or fat grafting to improve that.
Right.
The soof is the fat which is sitting just on the orbital rim, which gives the youthful look,
Yeah.
which we lose with time, unfortunately. So you can add the filler there or fat there to improve that.
All right, and that makes a lot of sense. So, any of you guys who are looking to have a new, fresh look, make sure to reach out to us and ask your questions about blepharoplasty or lid surgeries. And also, like,
Yes.
share, and subscribe.
Correct.
I'll see you in the next episode.